Welcome to this Deloitte 2022 Federal Budget presentation. My name is David Watkins. I'm an income tax partner, and it's my great pleasure to be here today, joined by two of my colleagues, Chris Richardson and Stephanie Allen. We had also expected to be joined today by our friend Laura Jays from Sky TV, but she will instead today be broadcasting from Melbourne at the Shane Warne Memorial. So the federal budget can be looked at from many different perspectives. At its heart, it's our annual renewal of promises that we make to each other as Australians with the ongoing objective of greater prosperity and greater fairness. It can be looked at through many different lenses: economics, health, COVID, infrastructure, tax, innovation, workplace, gender, many different lenses that people bring to the budget. And indeed, in the analyses that we did last night, and which are on the Deloitte website, we looked at the budget through many of those different views. Today, in this presentation, we'll look at last night's budget through three separate lenses: economics, health, and of course COVID related to that, and also taxation, individual taxation and business taxation. So that's really our agenda for today. So to get us rolling, we'll go across each of the panellists and just get a snapshot comment on initial observations from the budget. So starting with Chris.
You can ignore the fistful of dollars. Basically, it's politics, it's relatively short. I think there was something very important in last night's budget. It has major implications for the Australian economy ongoing, and in particular, it has implications for tax and the tax take, and indeed for our health and our mental health. It's a teaser at this stage. I'll explain more in a moment.
Thanks, Chris. So Stephanie Allen and I lead our global healthcare practice. So first of all, it has to be acknowledged that what we see in this budget for healthcare is a continuing commitment to actually fund policies for some of our most vulnerable groups. So we see policies and funding for mental health, for disability services and aged care, and I have to commend that. We also see ongoing funding to the tune of $6 billion in relation to COVID. So that's the continuation of the rollout of vaccinations, PPE gear, and also local manufacturing. And again, I commend that. However, I would say that there are four major missed opportunities in healthcare reform. And these are the really hard issues that we need to tackle. The systemic issues that make sure that we have a healthcare system that really is fit for the future. And again, I'll talk further about that in a few minutes.
Thanks, Stephanie. And from a taxation perspective, and in particular from a business taxation perspective, I've been involved for at least the last 10 years in the Deloitte analyses of the budget, and I can't recall a budget that had less to say about business taxation than this budget. Now, one can form a different view as to the consequence of that. That may well be a good thing. The tagline that we've gone with in respect to this year's budget is getting back to business. So in a sense, a budget that is not disruptive in terms of business tax, in a sense, that may be a good thing. There's been many challenges and disruption that businesses faced over the last couple of years. This budget, frankly, does not add to the uncertainty associated with business taxation. On the other hand, you may say that the light touch in respect of business taxation is a missed opportunity, because I think most people recognise that we haven't got the optimal tax system and the right tax mix. But on the eve of an election, this was not the budget to be addressing the big issues like that. So I'll hand over to Chris to unveil his teaser and to talk about this budget from an economic perspective.
Many thanks, David. Now, I have to admit, of course, all economists are natural losers as human beings. I have slides, all right? You'll probably be grateful for the fact because it means that you don't need to look at me. And if we could go to those slides, I want to put it in context for you, because the changes that have been happening in Australia have been happening at a head-snapping speed. Right, that chart is a chart of the unemployment rate in Australia. It was very high in the recession of the early 1990s. It moved up and down through the ups and downs of the Australian economy for a long time. And then came COVID. Now, there are lots of complaints about the Australian economy before COVID hit. And then you saw what you saw. It is almost 2 years ago to the day that we saw massive lines out at Centrelink as Australians formed Depression-era-like queues outside welfare offices. That was as weak an economy as many Australians would ever have lived through. And you can see the chart, right? The unemployment rate shot up. It actually hit 7.4% in a short period of time, but we know that was artificially low because we put all sorts of things in place. Now, however, we have an unemployment rate of 4%. That's already the best that we've seen in a number of years. Last night, Treasury said they expected by September the unemployment rate would be 3.75%. That would be the best that Australia's seen since 1974. And of course, you might question that forecast, and we at Deloitte do question that forecast because we think it won't be 3.75% in September. It'll be 3.5% in June. Right? What is happening in job markets in Australia is truly remarkable. Right? It has moved very, very fast, and it's moved fast for some important reasons. Basically, when the pandemic hit, we threw the kitchen sink at it. You know that the Reserve Bank basically cut interest rates to zero, and I shouldn't call it printed money, but basically it printed money. And governments, most notably through that JobKeeper scheme, they also threw the kitchen sink at this, and it worked. As the economy opened up again, as COVID became less of an issue, you have seen this remarkable fall in unemployment in Australia, and you're seeing it for the great reason that we are seeing a stunning amount of jobs. There are a handful of nations on that chart, and some of them, Australia, Korea, Canada, have more jobs today than when COVID hit. The likes of the US, UK, most places around the world don't yet have more jobs than when COVID hit. And remember, we closed our borders. It's not because we had more people, by and large, that we got more jobs. And you'll also note that we are a leader. That's a magnificent story. But it also gets to the heart of something that Treasury unveiled in the numbers last night. When they were talking about the economy and where it was headed and its implications for the budget, one of the key things they talked about, and the key ongoing difference in the economy and hence in the budget, was the amount of personal tax take. That's the billions of dollars of personal tax. You can see this is a chart direct from the budget papers, Treasury's estimates over time, back the bottom there, when things looked at their worst, and then the steady upgrades ever since. We are already getting much, much more personal tax than Treasury expected. But the implication now is that this is ongoing. All right, this is last night's budget. It's the first time they gave us figures around 25, 26. The thing that Treasury did in those new numbers last night, and you can compare it with the last time we got a budget update ahead of Christmas, 3.5 months ago. In that 3.5 months, a key change in a Treasury view is that the Australian economy, and in particular the Australian job market, will come out of COVID stronger than it entered it. That the job gains we are seeing at the moment, the things that are driving unemployment down so stunningly, that they are permanent. And this actually comes back to an old question, a debate in economics, seen in much of the world. And in Australia, we started to have it back in 2017. Now, the Reserve Bank said, we're having difficulty getting inflation to be, somewhere in our target range, as they did for many years in a row. We just can't get wage growth fast enough to get price growth, inflation, fast enough to get it into the zone they wanted to see. And they said, Treasury, government, you have to help. We need more demand in the Australian economy. The response from Treasury was, well, actually, we're not so sure. We're not that convinced that you can run the Australian economy hotter than employ more people than before, and do that without too much damage to the economy. And then came COVID, right? And we got this natural experiment, and in throwing the kitchen sink at it, it turns out that it was the Reserve Bank that was right. And last night, Treasury signed on to that. And since, in the 3.5 months since the last update, Treasury now thinks that the extra roughly 140,000 jobs that have recently appeared are just here to stay. And that's stunningly important. It's important in many, many ways. It's important because those are not average Australians. They are the people who struggled to get into jobs. They were seen by employers perhaps as too old, or they didn't have the skills, or whatever the reason was. 140,000 Australians having jobs from here on in, over and above. The official decision's been taken. We are going to be more ambitious, and we're going to be more ambitious on an ongoing basis. And that generates a big economy, generates a bigger tax take. That's a marvellous thing. Think of the implications that, when you work, you have better physical health, you have better mental health. It is a beautiful social dividend from that. You also, by the way, when you've got more people employed and lower unemployment, you get faster wage growth. It won't just be a benefit, ongoing benefit to that 140,000 people. It will be a wider benefit. And that is a genuinely marvellous thing. We don't know for sure yet whether it's true, but so far so good. It's also not the only thing happening. The zero line on the chart in front of you, think of the reaching further back in time to late 2019, when Treasury and Finance, as part of the budget update, the MyEFO back then, had a view on how fast the nominal economy, the bucket of money that we tax, call it national income, how fast that would grow. And of course, then came COVID, and the line mapped on that chart is where we are now relative to where Treasury thought we would be in the forecast it put out ahead of COVID. And of course, as COVID hit, we dropped underneath that view, and then we actually came back pretty fast. Our COVID defence, health and economy was pretty good. And now this, where we are today, this remarkable moment where we are today, is at least in part not just because our recovery from COVID has been faster and better, not just because we now think we can permanently run the Australian economy faster than before. We can keep the foot to the accelerator more than we used to think we could do. But also because of what's happening for the price of the stuff that Australia sells to the world. We basically sell the world energy and food. And it turns out that between them, Russia and Ukraine sell energy and food to the world. And that awful war over in Europe means that a lot of Russian and Ukrainian products aren't coming to world markets. You are seeing stunning prices for coal. Gas prices are higher, iron ore prices are higher, wheat prices are higher, and therefore the value of the Australian economy, what's getting taxed, is higher. That recovery in company tax take. These Treasury revisions, they've been coming thick and fast. If you go back, so the budget in May last year, Treasury revised up the dollars in the economy due to an expected higher tax take because we were recovering better from COVID. That added 110 billion. Roll on to December and that budget update. Treasury said, well, the COVID recovery is doing even better than we thought, and these prices for things like coal and iron ore are doing better than there's another 106 billion. Last night was the biggest update of them all, an extra $153 billion. We are coming back spectacularly fast, spectacularly beautifully. The big thought was, and always the fear was, that when you have a big downturn in the economy, that it lasts, right? Every other recession left behind this long, trail of people who stayed unemployed. The historical experience was in Australia and around the world, but we've got great data around this. In a recession, if you lose your job and you don't get it back in the next 2 years, you are very likely to never get a job again in the rest of your life. And what Australia has achieved is truly remarkable, right? And remember, Treasury last night didn't just add in the extra 153 billion. They also said, well, actually, these dollars are going to last, or at least some of these dollars are going to last. By the by, we tend to think of, government says this many dollars, we think of budgets as annual things, starting 1 July, finishing 30 June. But we've got monthly data. And it's interesting to see, we already know the actuals, what's already happened through to the end of January. And you can see there, you can see the remarkable drop into deficit that occurred as we threw the kitchen sink at a very weak economy. But if you were looking for a V-shaped recovery, you can already see it in the budget. That is a magnificent thing. But, right, we're going great. In particular, that ongoing story around the economy is a magnificent thing. You should be very happy and arguably very proud around what Australia is achieving. But there are challenges, right? There are some numbers, some costs in particular, that weren't in last night's budget. Partly because they're not yet known, but they are known unknowns, right? Number one, the world is a more dangerous place than it used to be. And over COVID, we all got lost watching the daily Gladys and Dan show, but other things were happening. And as the world became a more dangerous place, there has been a recognition that we do need to spend more on defence in Australia. And although last night's budget had some of that, it didn't have much of it, right? There are big expensive costs, not in the budget. So too around the wider social services budget. Now, to be clear, much has happened. There's already, over the last 12 months, the budget a year ago, the budget update ahead of Christmas, between them, they added $25 billion a year ongoing to our spend on social services, including the NDIS. But it's probably, and that's just a recognition, as Royal Commissions and other things told us, that we hadn't been doing enough. We hadn't been doing it right. But there are still inquiries underway and there are still problems. We are still playing catch up around social security. So some extra costs there. Or in other words, even though, the economy's come back very fast, even though the budget itself has come back very fast, there are ongoing costs. They're not COVID costs. But basically the cost of running Australia, as David correctly called it, the promises we make ourselves, that national social compact. We tax workers, we tax businesses, we spend it on the young and the old and the sick and the poor and a defence force. And so that became harder, it became more expensive. And we are going to need to do something about it. That's not, by the way, a conversation that Australia is going to have ahead of the election. They're not going to talk about those hard choices, but those hard choices probably imply a need to find ongoing annual savings in the budget of about $40 billion a year. You don't need to do that overnight, but you need to do it at some stage to pay for these extra defence costs, to pay for what's been happening around social security costs. And it's, it's not economics. It's just maths, right? We need some combination of cuts to other spending, increases in taxes, or cuts in, as they're called, tax expenditures. That's what the budget should have started to talk about, but it didn't, right? And remember, I started with a thought that 2 years ago, we had an Australian economy that was basically as weak as many, if not most, Australians would ever live through. We have today an Australian economy that is as strong as many Australians have ever lived through. Now, lots of people listening in may not see it that way, may not think of it that way, but you should. Why aren't you thinking of it that way? Because you're thinking of your wages, which haven't done much, and wages indeed, they remain the weak point in the economy. I agree with Treasury that they will pick up from here, but they're picking up from a very low level, and they're picking up slowly. And of course, weakness in wages is bad news that many people feel, whereas the strength that we're getting in jobs is good news for a relative handful of people. It's the people who weren't employed and they are now employed. Remember, most people are either, in a job and happily in that job, or they're not looking for, they're retired, they're raising the kids, they're whatever it may be. We have a very strong economy. And when you have a strong economy, you don't, it's the exact opposite of what was needed 2 years ago when we should have and did rise to that challenge and stomp on the accelerator. But you don't need that now. All the sort of fistful of cash that was offered to us and that will arrive in our pockets over the next 6 months, a period which coincidentally includes an election. When you pork barrel, basically, and remember that the opposition is busily signing on to this as we speak. The equivalent moment in 2007, Kevin and Rudd, Kevin said this reckless spending must stop. The reaction from the opposition thus far to the budget seems to be this reckless spending looks okay to us. All right, it is a bipartisan mistake that we're getting. We do need a difficult conversation around budget repair. Instead, we are throwing money at an economy that's strong. You don't. When an economy is strong and you throw extra money at it, it doesn't accelerate, right? It blows smoke. And that shows up in three ways, right? Again, the extra money, the fistful of dollars that's arriving. It generates three problems, the three I's. Number one, when the economy is at full stretch and you put extra money, give people extra money to chase things, to buy things, they will. And so the prices will go up. And we already have an inflation issue. So inflation is one thing we are adding to with these decisions we saw in the budget. Number two, now we happen to hold the minority view that the Reserve Bank is not about to raise interest rates. We think they will hang off until the end of this year, the end of 2022. Regardless though, the higher inflation is a red rag to a Reserve Bank. And there is a risk that they do introduce an earlier interest rate rise off the top of it. And remember, when you give extra money to an economy that is already stunningly strong, you don't necessarily strengthen our economy. You strengthen everybody else's economy, because we buy the stuff from over. It's the imports that go up. And it is that combination, which means that, what we saw last night was very political. I get it. If the test from an economist what should have been done? Well, the answer was very little. The economy doesn't need it. I understand that it doesn't matter what economists think. An election is around the corner, and to be fair, judged against that yardstick, you would say, an equivalent. It was a coalition government in 2007 made really big promises. A Labor government in 2013 made really big promises. These promises are more modest. But I would still call them a mistake. I shall now hand to my wonderful colleague and somebody I learn a whole heap from every time I listen to her, Stephanie.
Thanks, Chris. Thank you so much. So I'm going to spend the next 15 minutes talking about healthcare and what the budget has actually done for our healthcare industry. So the strapline for healthcare is really, this is a business as usual budget. But unfortunately, whereas Chris said we don't need to intervene in the economy, actually, from a healthcare perspective, I would argue quite the contrary. When I travel around the world or I chat to my clients, they ask me 3 questions. So they normally say, is the pandemic over? Then they ask me, what lessons did we learn from the pandemic? And then they ask me, what's next? So I'm going to kind of tackle those 3 questions, but highlight where I think the budget is supportive and has shown real commitment, and also where there are some of those missed opportunities. So the first question, is the pandemic over? Yes and no. So it would be fair to say that if you read any of the scientific journals around the world, we are much, much more likely to experience a pandemic of the sort that we've experienced over the last 2 years at a much higher level of frequency than we previously had. And there are whole reasons for that around the interconnectivity of the world, global travel, all of those sorts of things. We might even experience it sooner rather than later as we head into our influenza season. And whilst flu, we've actually had low incidences of flu over the last couple of years as we've been in lockdown and we've been washing our hands and all of those kind of new activities. What we haven't got is a resistance to flu as a consequence of that. And so we need to think about what is the next challenge on the horizon. It may be a new variant of COVID. It may be an entirely new pathogen that we haven't actually yet come across. So are we better prepared in Australia for that inevitability of the next pandemic? I would say absolutely yes. So one of the things that Australia has done very, very well, and the government should be commended on this, is that our health response was swift. So we shut our international borders very quickly. We went into various lockdowns and we had social cohesion largely around actually agreeing to those social lockdowns. And we were able, therefore, to prevent a number of the deaths that we saw in other countries and the huge pressure on our healthcare system that, again, we experienced in other countries. And now what we have is a real commitment going forward to the rollout of vaccinations, the local manufacturing of those vaccinations, and a commitment to the ongoing funding of PPE equipment. And that's to the tune of about $6 billion. So absolute tick in the box, Australia. We have done very well in our management of the pandemic. But I don't think we've done enough. So when we look at what we didn't do so well, we had very fragmented state-based responses to the pandemic. So even our public education was very confused. We had different vaccination and rollout programs. We had different lockdown and social mobility and movement across the country programs. And that created a real uncertainty, not only for our citizens within Australia, but also how we interacted with the rest of the world and how we actually got people back into Australia, some of those critical clinical workforce that we so need and so rely on. So a number of other countries are thinking very carefully about, in their lessons learned from the pandemic, what is the future of public health? Public health is the poor cousin of hospital-based care here in Australia. We typically spend less than 5% on our public health budget, and it includes things like surveillance. So we've done very well in terms of our surveillance of wastewater to try and predict where we're going to see outbreaks of the pandemic. But what we really need to do is to focus much more on a national collective strategy around how we're going to deal with the pandemic in the future. And I would urge Australia to have a think about that. One of the other areas that, again, I think is possibly a missed opportunity was in the wake of COVID, we had this incredible and new and novel partnership between government and the private sector, so large corporates and business. And there was the ongoing conversation around how do we get people back to work safely? What can corporates do to support the vaccination rollout, to support the boosters, to support track and trace, to support check-ins, so that we could get people back to work and the economy back on its feet again? And as Chris says, one of the most important factors around our mental health and well-being, and obviously our physical health as well, is having a job, having meaningful employment. So that has been a really interesting conversation that started in COVID. We also saw some fantastic collaboration between government and the life sciences industry. So never before has government agreed to fund a vaccination without it going through clinical trials. And so again, reimagining the social contract between government and corporates. And again, I think that there's a lot more that can be done in that space. And that's certainly something that I would encourage. So when we look about the lessons learned, we had this fantastic pivot, as did every country. Almost within about a week, we pivoted to having face-to-face consultations as part of our healthcare delivery model to actually going virtual. Now we use the telephone, we use video conferencing to be able to access clinicians and to seek that support around our health conditions. And indeed, all the consumer surveys that we have done and looked at show that patients really enjoyed that experience. Clinicians found it really valuable. And obviously, it becomes much more financially sustainable in terms of an ongoing way of funding health in Australia. What I think we're missing here is in the budget, certainly, we've seen promises around money for connectivity and interoperability, particularly in regional Australia. We've seen money for a mental health platform, so the Head to Health platform. And again, I would absolutely recommend those policy and funding decisions to you. But what we haven't seen is real investment and stimulation around an integrated and comprehensive digital health service. So this kind of came to me in a very, very real way over the weekend. So over the weekend, my 17-year-old son broke his fibula playing rugby. I'm sure a lot of you can resonate with that story. So we have then spent the last 3 days going into hospital, going to get x-rays, going to MRI scans, going to see the physio. And in all of those experiences, we have to show our vaccination certificate, we have to relay our, medical history, and everything is fragmented. In stark contrast to that, I booked my dogs in to go into kennels so that I could come down to Canberra to do this presentation today. And when I arrived at the kennels, they said, "We're delighted you're here. We know the dogs have got their vaccines up to date. We know they've had their kennel cough. Are there any other health conditions that you need to alert us to?" No. Bang, in they went. And so the integration of my dog's health was actually far more impressive than the integration of my son's health in almost a 48-hour period. And that can't be the case for Australia. We cannot let that be the way that we define our future. We know that digital mental health is complex and we need to not leave people behind, but we also know that it shows the promise of a better patient experience, better outcomes, and importantly, a more financially secure healthcare system of the future. And so I would have liked to have seen more impetus and focus on investments in those areas to really accelerate that growth that we started through COVID. And last but not least, what's next? So one of the things that was really silent in the budget was climate change and healthcare. And that was disappointing. So again, one of the key things that I want you to take away from this presentation is healthcare as an industry contributes a significant carbon footprint. In fact, it contributes twice the carbon footprint of the aviation industry pre-COVID. And there are many reasons for that. We have complex 24/7 buildings. We have incredibly convoluted supply chains. We have clinical gases and, one-use surgical instruments, and even think of all the PPE gear that we have to dispose of each and every day. So there are many reasons for that. But we can't stand behind the Hippocratic Oath and say, first, do no harm, if we as a healthcare industry are actually contributing to the deterioration of our environment and in doing so, the health of our nation. The World Health Organization last year said that climate change is the single biggest threat of harm to public health that we've seen. And we simply don't have anything in the budget that looks to address that. So in other countries around the world, we're seeing the UK saying that for hospitals to be licensed, they have to show that they're moving towards their net zero target. We're not seeing that here in Australia. And so I would argue that not only do we need to focus on how we reduce our carbon footprint in the healthcare industry here in Australia through the right incentives and the right policies, but we also need to face into a future where the demand for services is going to change. So again, we know through the way that the environment is already changing, and those changes have already been locked in, that we will see changing patterns in disease. We will see more respiratory conditions because of poorer air quality pollution. Here in Australia, we will see more heat-induced strokes, heart attacks, because of changes in climate, not to mention floods and dengue fever movement and all of those things that we see today. And so for me, there are two things that we should have addressed. We should have put policies in place and incentives in place to address our carbon footprint. And secondly, again, incentives to look into that future and to say, what are those future demands going to be to protect the health and well-being of Australians? And let's start moving towards that journey now. So business as usual for healthcare. Again, commend the ongoing commitment to aged care, to mental health, to disability, and to our COVID response, but more could have been done. Thanks, David.
Thanks. Thanks, Stephanie. So if we move to taxation and both individual and business, two overriding comments from the budget. Firstly, as I've already said, the budget really was a very light touch budget in respect of business tax changes. The other observation I'd make is that it's a transition budget. It's a transition out of COVID. Both Chris and Stephanie have talked about the really swift, good public policy decisions that we made as the COVID impact first became apparent. And the tax system was really right at the front end of how a lot of those public policy responses were delivered. JobKeeper, the cash flow boost, tax loss carryback, and temporary full expensing, for example. A number of measures to stimulate the economy, to help the community, were delivered through the tax system. And then what we saw in the following budget this time last year was a number of those measures were extended. What we see this year is that there is no further extension to any of those measures. Whatever was the due date for those measures to expire will happen in the normal way. So there's no further extension of the tax system to provide some of that COVID-related support. So I think they're two sort of headline messages about the budget. Light touch from a business perspective and marking a transition for the tax system of moving out of being part of the response to COVID. So individuals, firstly, this, I guess, has really been the headline item in the initial media coverage. 3 separate responses to support individuals, each being delivered through different mechanisms, to different audiences, and over different timelines. Firstly, and again, probably the number one headline item, is this fascination of politicians and petrol. The reduction in fuel excise, a 50% reduction for a temporary period of 6 months, effective immediately. Once you kind of gross that fuel tax excise adjustment reduction up for GST, that should see us benefit with a reduction at the pump of approximately 24 cents per litre. Obviously, that will change as global oil prices continue to change, be it up or down. But you can then sort of do a little bit of maths on that, depending upon the size of the petrol tank in your car, how often you fill your car, but it will work out for most people that the cost of filling the family car, be it with petrol or diesel, will reduce somewhere between $10 and $18 per tank of petrol. That's kind of individual support measure number one being delivered by a reduction in fuel excise. Measure number two, again being delivered directly through the tax system, is the LMITO, the Lamington or the Low and Middle Income Tax Offset. This was originally announced as one of the COVID stimulus measures. Essentially, it delivers an increased tax refund to low and middle income tax earners upon the lodgement of their tax return. That LMITO was increased by $420 last night, from a maximum of $1,080 for an individual through to a maximum of $1,500. That will be delivered following lodgement of 2022 tax returns later this calendar year, and that measure will be targeted at people earning up to around about $126,000. And the third cost of living response was a $250 one-off payment, essentially to existing welfare recipients, to be delivered next month. So that's the package of the three measures which the government announced last night to respond to the cost of living concerns, which it is very sensitive to. Moving to business tax, and as I say, there really was not a great deal in the budget last night. Perhaps the first point to comment on is, obviously, if there's a reduction in excise tax in relation to fuel, petrol and diesel, then for those businesses that are involved at various points in the supply chain for oil products, that also will necessitate some changes to their pricing and administration. Remembering, of course, that those excise reductions are effective immediately. So too, companies claiming fuel tax credits will need to be conscious of the changes in the excise. If we say that this is a transition budget coming out of COVID support, is there a theme that we can attach to the government measures from here? And perhaps if you kind of search, you can find a theme around innovation and around skills. You can certainly find that theme at a headline level. I think time will tell as to whether that has a material impact. But what am I talking about there? Firstly, the patent box. That was a measure previously announced by the government to introduce a concessional rate of tax for certain activities related to the commercialisation of R&D, to the exploitation of patents, with the objective of increasing activity in Australia in that sector, initially around the medical sector and the biotech sector, increasing activity, increasing employment, keeping Australian innovations onshore with the incentive, with the lure of a reduced tax rate for relevant income of 17%. What we saw last night was an extension of that kind of innovation-driven tax response, such that the patent box will be extended to deal with low emissions technology and also with technology developed in the agricultural sector. Again, kind of staying on that theme of innovation and skills, another measure announced last night, and this is only relevant to businesses with a turnover of $50 million or less, is what's called a boost. For every $100 spent, a tax deduction of $120. There's two separate limbs to this boost for small businesses. One is training expenses. Incur $100, $120 will be deductible. Separately, similar measure but targeted at expenditure to facilitate digital uptake and increasing adoption of digital technology in these small businesses. What's proposed is, ongoing business expenses and also capital items to support that digital take-up will also benefit from this boost, the 120% deduction for a spend of $100. We also saw last night in the budget that the government committed additional funding to the ATO to support the ongoing rollout of the Tax Avoidance Task Force. So that really provides the ATO, and hence business, with the assurance that the existing ATO activities around their various justified trust programs essentially will continue at least through until 2025. That's what the additional funding covered last night. That all then begs the question as to what is not there. What was not in the budget that people were looking for or expecting? One of those areas where we thought we may get some steer from the government is around the OECD BEPS work at the moment. People will understand that, will know of that as the Pillar 1, Pillar 2 processes, extensive international collaboration around reforms to the international tax system. True enough, those measures are still being finalised at the OECD level. Australia has signed on to that. What we were looking for last night was whether there was any further indication around timelines or revenue impacts associated with Pillar 1, Pillar 2, but there was no mention of that. And indeed, in terms of international tax generally, there were no changes proposed. So if we say, well, that's kind of what was in the budget and what was not in the budget, what else is out there? So one of the sort of acronyms in the trade is ABUMS, Announced but Unenacted Measures. You might remember when we had a change of government back in 2013, when the Abbott hockey team came in, Australia had a very extensive list of tax ABUMS, and they went through a process of taking some items off the list, of finalising other items, of trying to clean up that long list of announced but unenacted measures. And indeed, we're in a similar spot at the moment where there are many measures that have been announced which have not yet been enacted. In some cases, they are in bills in Parliament. In some cases, they have not gotten that far. Now, truth be told, there's clearly been other priorities that the government, the Treasury, have been focused on over the last 1 to 2 years, but there is an extensive list of these measures that are still yet to be finalised. And depending upon your particular area of interest, some of those measures will be more important than others. For example, changes to Division 7A relating to loans amongst family members and private companies, still yet to be finalised, yet to be developed and finalised. Changes to the definition of residency for companies, announced in October 2020, no progress at this stage. Indeed, the announcement just last month, on the 8th of February, when the government indicated that it would amend the law to permit deductibility of testing with rapid antigen tests and PCR with immediate effect, or indeed with effect from 1 July last year, 2021. At this stage, we have a press release. We don't have any law. Now, so as I say, there's a number of those measures that are still out there yet to be finalised. And the significance of that sitting here right now at the end of March, knowing that an election is just around the corner, is that any day, perhaps this weekend, perhaps by the weekend following, an election will be called. And that means Parliament ceases. Parliament is prorogued. All bills that are in Parliament lapse. And indeed today, under the current parliamentary schedule, irrespective of an election, today is the last day that both the House of Representatives and the Senate are due to sit. So any of those measures that the government announced last night, which need immediate legislation, any of those other measures which the government has announced in the past, which are not yet finalised but might be in the Parliament in various bills, really today is the day. So it will be interesting to see what progress is made to the legislative agenda by the time that Parliament rises tonight. And furthermore, once an election is called, the public service, including Treasury, go into caretaker mode, so the ability to consult and develop some of those other measures is also impacted. So if we say that last night's budget was a light touch budget in terms of business tax, where does tax reform sit amongst that? Now, we've seen tax reform become this poison chalice over the last decade or so. We've had new prime ministers, change in government, try and pick up that issue. The Rudd government in 2007 established the Henry Review. The Abbott government in 2013 commenced the so-called Rethink process. When Malcolm Turnbull became Prime Minister, he as Prime Minister and Scott Morrison as Treasurer looked at some systemic changes to the tax system and adjusting the tax mix. But for various reasons, each of those processes essentially have come to nothing. But sitting here now in a budget that really didn't address those difficult issues, but in an environment where we know that we have significant budget challenges ahead of us and where we haven't got the optimal tax system, all of that challenge around tax reform is essentially being pushed back to another day, another year, perhaps another government, whether that be a re-elected coalition government or a Labor government. But tax reform, the big hard issue, really is sitting on the shelf where it's been essentially for at least the last 15 years, but one day driven by budget challenges and the need to improve our tax system. One day we have to take on that really hard challenge as a society.
Thanks, David. Thanks, Stephanie. It is absolutely marvellous to have the band back together and sort through some of these issues for you. We're going to do a bit of a wrap, and I'm just going to chase through on any last thoughts that people want to leave you with. And I'm going to save the last spot for myself because I'm that sort of person. Stephanie, if I could turn to you first. Any last thoughts for people?
Yeah, so for me, Chris, it's, the budget is a very welcome continuation of those really important initiatives for those vulnerable groups. So mental health, disability, aged care, regional, and that's commendable. But for me, there's a lost opportunity. So for me, we have seedlings, kernels of innovation and acceleration that have come through COVID that we haven't capitalised on. And I would love to see the next government actually really start to address the systemic issues in healthcare around quality and access and affordability. And so for me, in the context of a really strong economy, in the context of having managed the pandemic really well, I would go to the words of Tracy Chapman and say, if not now, then when?
Which is equally appropriate from a tax perspective. If not now, and it's not now in terms of tax reform, then when? I guess my wrap-up comment would be, to business, kind of enjoy the calm. Our budget analysis was framed in the context of getting back to business. Business can operate in an environment at the moment where it's not being distracted by announcements in the budget. Enjoy the calm, but at some time in the future, there are some really hard decisions politically, economically, tax mix-wise that we need to make, and time will tell as to whether that starts to emerge in the next parliament. But for the moment, I guess enjoy the calm of a light touch budget.
And as always, with my two colleagues here, a very, very thought-provoking, sufficiently thought-provoking that it's changed my last thoughts for you. Stephanie and David both talked about things that Australia should do. And whatever your field of expertise, you're going to know a bunch of things there as well. Certainly true in my field of economics. There are a bunch of things that Australia could do better. Except, I would say, thinking back to something that was said about Australia in a comment in an article in The Economist magazine in 1986. And it said, Australians are magnificent managers of adversity and terrible managers of prosperity. And you could maybe sit that context here. We just handled COVID really well. And as prosperity roars back, we're starting to maybe run out of steam. I would put it a little bit differently, though, to that comment of a third of a century ago. I think Australia handles crisis well. I think we handle chronic badly. You look at the global financial crisis, right? And the world was very impressed with what Australia did. And that was done under a federal Labor government. Again, we are a global standout in terms of health outcomes, in terms of economic outcomes, in a very different crisis under a federal coalition government. Be proud of what Australia does in a crisis. But we're not so good at chronic. We slow down over those longer term challenges in the economy, in health policy, in tax reform. And that's, I fear that's not necessarily going to get better. And I also fear that we may be about to see another rerun of this. In the next couple of months, we'll have an election. Key advice: don't listen to any politician in the next couple of months, because they'll be lying a lot as that competition, if you like, around the election comes to the fore. But do remember, right, on the other side of the election, as a nation, we're going to have to rise to a whole bunch of complicated, chronic challenges. And that's not the thing that we've been historically good at doing. That's the new fight. I commend it to you. Thank you very much for joining us here today. We are proud Deloitte colleagues. Deloitte globally, 1/3 of I'm going to say, the smartest people in the world, and 3 of the best here today to talk to you. We have very much enjoyed your company. We hope you have enjoyed us too. Thank you very, very much for joining us today.